Optic atrophy. Optic atrophy is a pathological definition and also a morphological aftereffect due to degeneration of the axon and nerve fibers caused by damage to the anterior part of the visual pathway. Optic atrophy is characterized by various damages to the visual function and optic nerves. Chinese medical ophthalmology ascribes this to qingmang, literally bluish blindness. The causes of optic atrophy include heredity, optic neuritis, ischemia, trauma, toxicity, tumors, glaucoma, nutritional disorders, and demyelinating diseases. Clinical manifestations: gradual vision loss, constriction of the visual field or shading in some parts of the visual field. The condition may aggravate gradually, even causing blindness in severe cases. In examination of the fundus, the disc can be found discolored or totally pale. Treatment method. Method 1, acupoint joining. Case 1, ischemic optic neuropathy, optic atrophy. Number 1. Sanjiao 23 joined to Yuyao. Sanjiao 23 is the acupoint of the hand Shaoyang Sanjiao channel, located in the depression over the tip of the eyebrow. Yuyao is an extra point located at the midpoint of the eyebrow directly above the pupil. Insert the needle into Sanjiao 23 obliquely, joining to Yuyao. Retain the needle for 30 minutes. 2. Taiyang joined to gallbladder 1. Taiyang is an extra point located in the depression about 1 cun behind the midpoint of the lateral end of the eyebrow and the outer canthus. Gallbladder 1 is a converging point of the foot Shaoyang gallbladder channel, the hand Taiyang small intestine channel, and the hand Shaoyang Sanjiao channel, located 0.5 cun lateral to the external canthus. Insert the needle into Taiyang obliquely or horizontally joining to gallbladder 1. Retain the needle for 30 minutes. 3. Stomach 2 joined to Sha Jingming. Stomach 2 is a point on the foot Yangming stomach channel located 1 cun directly below the pupil in the depression over the infraorbital foramen. Xia Jingming is located 0.2 cun below bladder 1. Insert the needle obliquely into stomach 2, keeping the tip positioned upward, and needle to the point about 2 cun below bladder 1. Retain the needle for 30 minutes. 4. Gallbladder 14 joined to bladder 2. Gallbladder 14 is a point on the foot Shaoyang gallbladder channel and the converging point on the foot Shaoyang gallbladder channel and yang linking vessel. Gallbladder 14 is located 1 cun above the middle of the eyebrow. Bladder 2 is a point on the foot Taiyang bladder channel located in the depression over the medial end of the eyebrow. Insert the needle obliquely into gallbladder 14, joining to bladder 2. Retain the needle for 30 minutes. Method 2. Combining the 3 acupoints around the eye with gallbladder 20. Case 2. Optic atrophy. Gallbladder 20 is a point on the foot Shaoyang gallbladder channel and the converging point of the foot Shaoyang gallbladder channel and yang linking vessel. Gallbladder 20 is located in the depression between the upper ends of the sternocleidomastoid and trapezius muscles at the level of due 16. Obliquely puncture 1 to 2 cun towards the opposite side eye. Lifting, thrusting, and rotation is applicable. Retain the needle for 30 minutes. Xiangming is located directly below the midpoint of the eyebrow in the depression inferior to the supraorbital ridge. Needle slowly along the crevice between the supraorbital ridge and the eyeball, keeping the needle tip slightly upward. Insert to 1 cun if there is no resistance. Lifting and thrusting is contraindicated, but light rotation or flicking of the needle handle is applicable. Retain the needle for 30 minutes. Point combinations. Large intestine 4 is located at the midpoint of the muscle between the thumb and index finger. Needle perpendicularly to 0.5 to 0.8 cun. Manipulate with even supplementation and drainage. Spleen 6 is located 3 cun anterior to the medial malleolus in the depression over the posterior ridge of the tibia. Needle perpendicularly to 1 to 1.5 cun. Manipulate with even supplementation and drainage. Based on the presenting patterns, select points mainly according to the affected channels. Local points and body points may be combined. Because optic atrophy usually requires a long course of treatment, point selection should be especially accurate. The process can follow a 4-2-2 rule. That is, 4 points beside the eye, 2 points on the head, and 2 points on the body. Method. When puncturing points around the eye, insert the needle to the proper depth, then apply even supplementation and drainage. Treat once daily, retaining the needles for 30 minutes.